Helen Farmer with you. You ask, we reply. We had so many messages over the last few weeks and months about allergies in children, and that's what we're focusing on between now and past.
This is Afternoons with Helen Farmer on DubaiEye 103.8.
With Mubadala Health Dubai, a specialty clinic and day surgery centre for every stage of your family's life. Trusted for care. Call 800-77.
Joining us today, we've got Dr. Mathew, Consultant General Pediatrician and an allergy specialist at Mubadala Health. And we're talking about a critical and very timely topic, an alarming rise in food allergies amongst children. Now, recent research has actually revealed a doubling of food allergy cases in the last decade, with young children in particular being disproportionately affected. And we've tragically seen loss of life and really big headlines, and for good reason. So joining us today, we can rely on our doctor to answer your questions. So if you do have any concerns, if there's something happening in your family, you want to talk diagnosis, signs, symptoms, do reach out. We're going to be talking about what parents can do to protect their children from allergic reactions. You can reach out on 4001 on the ARN Play app. And of course, you've got the WhatsApp too. Doctor, how are you today?
Yeah, fine.
Thank you so much for your time today. I know how busy you are, especially around this topic. So let's get straight to it. What do you think is behind this dramatic rise in food allergies in young children over the past decade?
Yes, definitely. That is a fact that allergies are in a rise. Not only the food allergy, all the allergies, including the allergic rhinitis, asthmas, environmental allergies, all are increasing. So if you ask me what is a cause, I can't give a definite answer because there are many theories behind it. So the first important theory what they propose is about hygiene hypothesis. Okay.
Hang on, let me just hear this. Let me understand this properly. The hygiene hypothesis.
Yes.
Are we too clean or are we too dirty?
Yeah, I think we are becoming too clean. So what they suggest is because we are becoming more clean and more hygienic. So our kids are not exposed to the usual infectious agents and parasites and all like before.
So let me just completely bottom line this.
Yes.
Back in the day.
Yes.
Me, my brothers, friends would be in the garden. We'd be, worms and making mud pies and, all of that kind of stuff. And now we're maybe a bit too happy with the sanitizing wipes and the keeping all the surfaces absolutely pristine. Yeah. But which we think we're doing the best thing for our kids, right?
Yes, that is a good thing. But in the perspective of allergy, the thing is in the kids' immunity, they mature in the first 1 or 2 years, no? So once they are not exposed to this type of parasites and infective agents, the maturity of their immune system is not doing proper.
So we're not tough enough, and we become more reactive as a result. Okay.
Yes.
Are there any dietary issues that we can point to? Because there was research a while ago that showed that we were terrified of peanuts, and as a result, we weren't giving peanuts to kids at all. And then we saw a massive spike in peanut allergies as a result.
Yes.
What impact do you think of maybe the modern Western diet on this spike in food allergies?
So this is also one of the pollutants, the refined foods, all those things, all those type of the newer food products and all. So this food, they can affect the intestinal integrity. They can affect our normal bacterial flora. We call as microbiome in our body. Everyone have billions and billions of bacteria and other organisms, and the balance of this microbiome is affected by use of these refined foods and also use of antibiotics, excessive use
overuse of antibiotics.
So all those things can affect the integrity we call as epithelium, the covering of the intestine and covering of the nasal, the superficial covering of the nasal cavity. So this affecting the integrity, it can lead to make us prone for allergies.
So, Dr. Ashi, can I ask you, I mentioned peanuts there, but, in your practice at Mubadala, what are you seeing the most common food allergies? What's coming into clinic and you're like, wow, that's actually a bit of a pattern now?
Okay, the food allergies, any food can cause allergy. Okay, any food containing the protein content, anything can cause allergy. But in the practice, we see the commonest food, one is cow's milk, which is very common, especially in infants.
So like the protein in a cow's milk.
The protein in that. So don't confuse with the galactose in that. That is lactose intolerance is different.
Okay.
This is cow's milk protein, the casein and whey proteins in the cow's milk. This is one cause of allergy. Other things are tree nuts and peanuts. So many patients with this nut allergies. Then wheat allergy. It's wheat intolerance. Celiac disease is entirely different. This is a wheat allergy. Then we have soya, and then also fish and shellfish. These are the common foods and sesame also.
I think that's a really good point to make about the difference between an intolerance and an allergy. So would you mind explaining some of the red flags, the signs, the symptoms that a child, even a baby, a toddler, might be allergic to a particular food?
So if you talk about allergies, we can divide into IgE-mediated allergy and non-IgE-mediated allergy.
Oh, you've lost
so
me.
it will be a difficult. So as I told, the commonest allergy, whenever we take the food, the inciting food, within 30 minutes to 2 hours, they develop the symptoms. The main symptoms are itching and also the rashes, the hives, and also it can go to very severe reactions like swelling of the lips, swelling of our upper airway, breathlessness, hypotension means the blood pressure drops. So these are the different presentation of the IgE mediated, which is the commonest type of food allergies. But there are other type of allergies. We cannot explain allergy in a single pattern. Okay, there are non-IgE mediated allergies where they will have vomiting and diarrhea alone, but they may not have the skin manifestations. They may not have the rashes. So there are different types of allergies, but the commonest was what I told is the itching, rashes, urticarial lesions.
It must be very difficult and confusing for people to understand exactly what is creating those symptoms. And I wondered if maybe you could explain how you go about diagnosing and the gold standard of food allergy testing.
Okay. So if you know that, if a particular food is taken and within few minutes the child developed the allergy, so we know that, this is the food which causes the allergies. But in case most of the time it will be a mix of food. So we cannot pinpoint what causes the allergy. So we have test, we call a skin prick test, which is one of the gold standard of finding out the food allergies. But that we use a very small amount of food which is commercially prepared, and then we do a testing on the skin, and the skin will give the reaction. So that is one of the best ways. But we have some of the kids may not prefer that pricking on the skin. So we have the blood test also. We call a specific IgE for that food. So not the other type of many food intolerant panels and all is that they are not scientific. For food allergies, we have to go for specific IgE test, and from there also we can find out these are the two important diagnostic tests.
Send in any questions. We have stolen away Dr. Mathew from clinic at Mathew Health until 3:30 today. So if this is raising any red flags with you, you're thinking, I really want to get to the bottom of this, or maybe you're pregnant, you've got a little one, you're about to start weaning and don't know how to do it in a safe way, do get in touch. We'd be very, very happy to help. Sophie's message asking, when might you start detecting allergies? My 3-month-old sometimes gets very red eyes. And Bobby asking, can kids just grow out of them? We're going to go to the text line after this.
More of Afternoons with Helen Farmer is coming up next.
On the UAE's #1 talk